Hi, I'm Erin Smith. Today, Amy Sampson, Ayesha Preddy, and I will be discussing bipolar disorder 1. So, we're going to define bipolar 1 and discuss the signs and symptoms. We'll also consider bipolar from a historical and social context and see how treatment, management, self-care, support, and recovery is now managed today. We're also going to have a little look at the Australian contemporary picture and share some lived experiences. And we're going to conclude with some recommendations for future mental health nursing practice. So, how is bipolar 1 defined? The American Psychiatric Association describes it as a mood disorder in which a person experiences a manic episode with or without a hypomanic or major depressive episode. The extreme mood disturbance often results in major fluctuations of energy, activity levels, concentration, and the ability to carry out day-to-day tasks. To be diagnosed with bipolar disorder 1, the client must have had at least one manic episode in their lifetime. A manic episode is a distinct period of abnormally and persistently elevated, expansive or irritable mood and abnormally persistently increased activity or energy accompanied by abnormal behaviour that disrupts life, lasting for at least 1 week. A person living with bipolar 1 may also experience hypomanic or major depressive episodes, but these are not required for diagnosis. A hypomanic episode is where a person experiences a mild form of mania that is not severe enough to cause impairment in social or occupational functioning or warrant hospitalisation. It must last for at least 4 consecutive days for most of the day. A major depressive episode is also common in bipolar 1. So major depression is a marked change from a person's previous functioning. It requires a persistently depressed mood or loss of interest in activities, causing significant impairment in daily life. It must occur over at least a 2-week period. Mania and depression should not be explainable by any other disorders such as schizophrenia. So the first known references describing bipolar 1, like symptoms, come from the ancient Greek melancholia, meaning sadness, and ania, to produce a great mental anguish. Up until the 19th century, people with mental illness were generally cared for in their homes by their families. But then psychiatric disorders became medicalised and lunatic asylums were established. French psychiatrists Pinel, Heinroth, and Esquirel all believed that melancholia and mania were distinct disorders. Then in 1899, Emile Kraepelin, the father of modern psychiatry, unified affective disorders and created the term manic depressive insanity to describe the cyclic pattern of symptoms seen in bipolar. In 1948, John Cade discovered that lithium was an effective treatment for manic depressive psychosis. In the 1980s, manic depression was then renamed as bipolar disorder by the American Psychiatric Association. Since then, it's been reclassified into 2 forms of the disorder, bipolar 1, which we're talking about today, and bipolar 2, which is distinct for its absence of mania. So we'll share more about how bipolar is treated and managed later. So the signs and symptoms. Bipolar 1 is often characterised by the movement of the person between manic, hypomanic, and major depressive stages. And this may also be interspersed with periods of normal functioning, although as mentioned, the only criteria that clients must experience is mania. Signs and symptoms will also vary in intensity between people. During a manic episode, there is clinically significant change in mood, energy, motivation, behaviour, sleep, and cognition, and these will last for most of the day for at least 7 days. Consumers must also experience 3 symptoms, such as inflated sense of self-esteem or grandiosity, decreased need of sleep, more talkative than usual, racing thoughts, increased goal-directed activity or psychomotor agitation like pacing, excessive involvement in activities with a high potential for painful consequences, things like buying sprees and sexual indiscretions. Conversely, on the other side, a major depressive stage, the person has to display at least 5 symptoms, and these will include things like a depressed mood, anhedonia, significant weight loss or gain without trying, insomnia or hypersomnia, psychomotor retardation or agitation, fatigue, feelings of worthlessness, and recurrent thoughts of death or suicidal ideation. With regards to suicidal ideation, we just think it's really important to share a really startling statistic we found in a worldwide systematic review. 30% of people with bipolar 1 will go on to attempt or complete suicide. Most attempts are made during a depressive episode, but not all, so we'd just like you to consider this when working with patients with bipolar.